Jump into chapter 12. We're going to talk about the hip, thigh, knee, patella, lower leg, ankle, and foot. These are the anatomical structures that make up the lower extremity. The mechanisms of injury for the lower extremity are often different compared to the upper extremity. Due to the fact that almost all activities for athletics are weight bearing, we see different mechanisms of injury. Due to this weight-bearing component, the lower extremity is often injured when the foot is in contact with the ground. Therefore, when a lower extremity injury occurs while the athlete is weight-bearing, we need to always make sure we check for injuries that may have occurred from the toes all the way to the hip, because this is all connected through the kinetic chain. We're going to first start with the hip and thigh aspect of the lower extremity. The hip and thigh, specifically the hip, is a ball and socket joint. It's made up the head of the femur and the acetabulum of the pelvis, and because of this nature, it creates a lot of hip motion. Not as much as we see at the shoulder joint, which is also a ball and socket joint, but a lot of range of motion for the lower extremity. As we get into looking at injuries, our first injury is going to be our femoral fracture. We're going to first look at the acute part of a femoral fracture. Even though the femur is the strongest and largest bone, both acute traumatic and stress fractures can occur. Most acute fractures occur to the femoral shaft, and we can see in this picture of femoral shaft fracture. Not only do we have to worry about different types of fractures like oblique, transverse, comminuted, and spiral, we also have to worry about open fractures. And these fractures can occur when the bone sticks out of the leg and bleeding occurs. When we look at the mechanism for an acute femoral fracture, the amount of force really needed is substantial to break the femur. So the number one cause of acute traumatic femoral shaft fractures is a car accident. We can also see these fractures occurring from falls of a great height. But if we're looking at athletics, most times it's going to occur in high velocity collision or contact sports. We look at signs and symptoms. When we see an acute fracture, the athlete's going to be in excruciating pain. They will most likely go into shock, and they're unable to put pressure or stand on the leg. There is a deformity that appears. The leg appears crooked and looks shorter than the other side. Open fractures also do have deformity, but we also have bleeding that exists that we need to take care of as well. For treatment, we want to make sure that we treat the athlete for shock and call 911 immediately. We want to leave the athlete in the position that we find him or her and splint them in that position and take care of any bleeding if it is an open fracture. After that, we want to make sure that we send them along the way with 911 to the emergency room to get it set and healed. With open femoral shaft fractures, we really need to make sure that the potential for the athlete to sustain a secondary infection is really great because of this external bleeding that does occur. So we have to make sure that we do clean it well and pat it well before they are sent off to the hospital. This picture is a picture of how we can support or splint a person that has a femoral fracture. You can see that we are still splinting above and below the injury site. So we can see on that left side, there is one splint should reach from the armpit to past the heel. So it is along the whole body. And the other splint should be long enough to reach from the groin and past the heel as well. And then we're going to wrap tape or some sort of cloth around to keep that splint in place. So we can do this, or we can use the opposing body part as a splint as well. So in this picture, we can use the left side of the body to splint that right side fracture. For prevention, due to the amount of force that it takes to have a femoral fracture, we may not always be able to prevent it, but we should make sure that the athlete is still wearing the appropriate equipment when they're playing sports. For a stress fracture, when we look at mechanism of injury for a stress fracture, we know that stress fractures are not common, but they can occur from repetitive motion and forces applied to the femur during constant weight bearing. And when we look at these stress fractures, they're going to occur in a different spot than the acute fractures. And stress fractures usually happen at the neck of the femur, so up where it attaches to the ball and socket joint. When we look at signs and symptoms, they're going to have pain in the hip or groin area that increases with activity, swelling, point tenderness, inability to fully weight bear on the leg, thigh muscles become weak, loss of hip function, and they have an antalgic gait or an abnormal gait. For treatment of stress fractures, we want to make sure that we remove the athlete from any activity that aggravates that hip or increases the signs and symptoms. Apply ice to the area and a compression wrap to support it. Fit for crutches if there is a limp to make sure that they're ambulating as best as possible. Have the athlete take anti-inflammatory medications and refer them to a physician. Most times when they see a physician, they may take an x-ray, see what's going on, but we want to make sure that we continue to heal and get them out of activity. These could take several weeks to heal. Prevention for stress fractures is proper conditioning. We don't want to jump into competition or a new workout or running very quickly. We want to ease ourselves into that, and as well as including muscular strengthening within our conditioning programs. Next, we have a hip dislocation. A hip dislocation occurs when the femoral head displaces from the acetabulum of the pelvis. Most of these are posterior dislocations, and the femoral head is forced backwards out of the joint. For a mechanism of injury, a substantial traumatic direct blow to the hip needs to occur to a flexed knee with a force placed upward through the femur. So really you're taking that leg and forcing it posteriorly. Or we can see that a foot can result in a hip or the foot can result in a hip dislocation as well if we have that upward pressure to the foot area. They can also occur in car accidents, high impact events such as football, a football tackle or a rugby tackle, as well as jumping from a height. The other mechanism that we can have for a hip dislocation is we see that the hip is flexed, adducted, and internally rotated, or flexed, abducted, and externally rotated when the foot or knee strikes the ground or another object. So this is really when we're weight bearing and it's forced posteriorly as well. Signs and symptoms for hip dislocation include the athlete experiencing shock. They cannot sit up or move the hip into an adducted position. They cannot internally rotate, and the injured leg appears shorter than the other leg because of that displacement. So this is what it looks like when we walk up or evaluate or have a primary survey of a hip dislocation. You can see that flexion of the knee, internal rotation of the hip, and flexion of the hip. So this is a primary telltale sign that the person has a hip dislocation. Treatment, we need to make sure that we call 911 immediately, not move the athlete, and if we're splinting them, we want to splint them in the position that we find them. Of course, treat them for shock because this is a high impact injury, and then monitor their ABCs as EMS is on their way, so airway, breathing, and circulation. Prevention, again, it's not entirely possible to prevent a hip dislocation, but we need to make sure that we avoid high-risk activities to avoid hip dislocations. Depending on the activity, this may not be possible. Our next injury is a hip strain. Just like any other, a hip sprain, and like any other sprain in the body, we have sprains of ligaments in the hip. When we look at sprains in the hip, they can be acute sprains to the iliofemoral, ischiofemoral, and pubofemoral ligaments. And this is really occurs when the hip is dislocated because the ligaments are very, they're stretched to a large degree past their normal motion. When we look at this motion or this mechanism, it's basically a forceful stretch of the ligaments due to excessive involuntary hip joint range of motion, and this is typically caused by that hip dislocation. Signs and symptoms, they'll have hip pain, they won't be able to flex their muscles, they'll have joint stiffness, a limp when they're walking, swelling and point tenderness over the area. Treatment, immediately we want to put rice or use rice theory, have crutches and cane available for them to ambulate well. I take anti-inflammatory medications for the pain and any inflammation that's there. If they don't subside over a couple days, so if the signs and symptoms don't subside, then we want to refer them to a physician to see if there's anything else going on in that hip area. For prevention, we're going to wear hip protective equipment and padding to make sure we have good range of motion in that hip area as well. Hip bursitis is another injury that we see at the hip. When we look at the hip bursitis, the trochanteric, iliopsoas, and ischial bursae are located within the hip, and these are all three of these bursas that can be inflamed in hip bursitis. Remember that a bursa is a fluid-filled sac, and it assists in providing cushion between bone and soft tissue so that we get that fluid motion, especially at the hip and ball and socket joints where we need a lot of fluid motion. But these can be inflamed, and we can typically see this over a long period of time with chronic overuse injuries. So when we look at the three different types of bursae in the hip, trochanteric bursitis can occur if an athlete has a tight iliotibial band that continues to rub against the bursa. Iliopsoas bursitis occurs from repetitive hip flexion, so running typically. And then ischial bursitis can occur with prolonged sitting or moving the hip from flexion to extension repeatedly, such as riding a bicycle over and over again. Signs and symptoms include severe, dull, diffuse pain around the hip area. They may have stiffness, point tenderness, and a snapping feeling. And this snapping sensation, especially with trochanteric and iliotibial bursitis. We want to apply the Rice principle to treat hip bursitis to alleviate any swelling in that bursa and avoid all activities that aggravate the injury. If this doesn't help with any of the signs and symptoms, we want to make sure that the athlete sees their physician if the pain lasts over a week period of time. For prevention, maintain normal weight so we don't place undue stress in this area, and good posture when lifting, sitting, and moving the hip joint. As we continue with the injuries of the hip, we have some injuries that happen with younger athletes or adolescent athletes, and one of them is going to be Legg-Calvé-Perz disease. And Legg-Calvé-Perz disease, first and foremost, it can't be prevented, so we'll get to that in a little bit, but really what it is, it occurs when the femoral head is deprived of blood, and we really don't know why this occurs, but the bone, because of the lack of blood supply, becomes necrotic or starts to die, and that top of the femur starts to break. Remember, this is most commonly seen in children. So look at signs and symptoms. We could see that the child complains of hip pain and or pain that is referred down to the groin and knee area. The pain is most noticeable when the child is active. So when they're moving around a lot, it starts to increase in pain. At rest, typically the pain goes away. We can also see a child that has stiffness, lack of range of motion in the hip, and walks with a limp. But when we do take x-rays, you'll see in this picture, we see that top of the hip, we can see a healthy bone, head of the femur at the top picture in that circle. But when we look at a necrotic bone, or when it lacks blood supply, remember, unknown reason, it starts to flatten because the bone starts to break down and break off. Treatment for this, we want to make sure that because they are adolescents and they're underage, we want to speak with the child's parents and refer them to a physician for evaluation. Really, there's two options. They have a non-surgical approach where there's a lot of rest, and there's also a surgical approach as well. Read more about that in the textbook, but if you have a child or you're working with children, they start to have hip pain and you don't know anything else that it could be, it may be this, so your number one job is to refer them to a physician. Another one that happened in younger children is slipped capital femoral epiphysis. And this is a condition that, again, occurs in children, especially pubescent and adolescent boys who are overweight for their height, so shorter and a little bit heavier. The femoral head in this injury slips backward out of the acetabulum. So look at mechanisms. The cause for this is really unknown, but it does go along with the child's growth patterns and them being overweight for their height. But the bone's growth plates are weak during puberty and adolescence, and they are typically growing fast at this time. So as a result, the femoral head moves back out of position from the acetabulum. And the weight is a problem because the weight, if you're overweight for your height, places a lot of undue and extra stress to the hip area. Signs and symptoms, again, we have hip and knee pain, and the affected leg appears shorter and turned outward. But remember, this is in children, so we need to be careful for treatment. So when we treat, we want to immediately refer them to a physician. And once we do figure this out, it is best to have them evaluated within 24 to 48 hours for the best outcome. And when we do have this backward slippage of the femoral head, we want to have surgery for it, as they will go in and tighten everything up so it doesn't happen again. Prevention, like I said, it's not preventable. It's kind of like leg calf purse disease. We don't have a way to prevent it. A little bit more common in athletics, we have piriformis syndrome. The piriformis is a muscle in the butt, so sometimes we joke in athletic training that this is the pain in the butt kind of injury, but the piriformis attaches from the sacrum to the greater trochanter or the femur, and it really functions to externally rotate the hip. And when we look at this in conjunction with the ability of the piriformis to help stabilize the hip and maintaining balance and weight when weight bearing, it becomes inflamed when we have repetitive motions over and over again. And once the piriformis gets inflamed, it can affect the sciatic nerve underneath of it, because it then goes on to compress that sciatic nerve. So mechanism of injury, it's due to overuse, and typically repetitive continual motions cause this muscle to become inflamed, so running over and over and over again, and it causes tightness in that area. Signs and symptoms, we have sciatic nerve pain that appears. It may be shooting down the back of the leg. They can also feel also have a loss of hip internal range of motion, burning pain down the posterior thigh and knee, pain in the butt and hamstring area, tightness, stiffness, and point tenderness. And you can see some other ones on there as well. For treatment, immediately we want to make sure that they rest from activity so that we can calm down that muscle area, whether it be a spasm or some sort of irritation to that muscle. We want to make sure that we stop that activity so it relaxes and stops irritating the sciatic nerve. We can help this by taking NSAIDs and ice and then heat after a period of 72 hours. And then we can slowly stretch and do exercises in that area. If these signs and symptoms that we talked about before don't decrease after using the above treatments, then we need to refer them to a physician for further evaluation. For prevention, we want to see someone that gradually increases intensity in a workout or exercises, maintain proper posture when sitting, lifting, and running, and we want to make sure that they have good flexibility in the piriformis and their surrounding areas. A groin strain, again, very common in athletics. The groin muscles or the adductor muscles run along the medial thigh, and these include the adductor longus, magnus, and brevis, as well as the gracilis and pectineus. These muscles are commonly injured in athletics with activities that require running and sudden changes of direction. So if someone's cutting a lot, or a lot of groin strains occur in hockey and how they skate. So a mechanism of injury for a groin strain is the leg is forced into abduction with or without lower extremity rotation. The foot may or may not be planted on the ground when the injury occurs. So when we look at signs and symptoms for a groin strain, again, like typical strains, they're going to have a loss of range of motion. They may have ecchymosis, swelling in the area, and other signs and symptoms such as pain, point tenderness in the area of the adductor muscle that is strained. For treatment, we really want to use the Rice principle, rest ice. We could use a compression wrap to help support the area and take anti-inflammatories. If the person is unable to walk well, we could also fit them for crutches for a couple days to release some of that pain. Prevention, we want to make sure that we have strong but very flexible groin muscles to help prevent this type of injury. A quadriceps strain usually occurs to the rectus femoris muscle, and this occurs when the athlete concentrically or eccentrically contracts the muscles during acceleration or deceleration movements. And what we see when this happens is that they have a lot of pain. They may have a muscle spasm, loss of function, and point tenderness in the area. And the pain increases when the athlete attempts to contract the quadriceps by moving the knee into extension or the hip into flexion. The pain can also, however, increase when the athlete passively moves the knee into flexion, so when they elongate that quadriceps, and the hip into extension. Most times we don't see any visible signs and symptoms except when we get to grade 3, and grade 3 strains may have a bulge and or a divot in the muscle where it has been ripped or ruptured. Rice is a typical treatment, as well as crutches if the athlete cannot walk without a limp, and the anti-inflammatory medications again. And for prevention, we make sure that they have proper warm-up and cool-down, maintaining range of motion, flexibility, and strength in the quadriceps area. And on top of that, we want to make sure that we have the balance of quadricep and hamstring muscles even. A quadriceps contusion typically occurs with a blow to the quadriceps area, either from another object or from a person. And if the muscle is contracted when this is a direct blow occurs, the injury often is more severe than if the muscle is relaxed. Typically, we see a pain, loss of range of motion, point tenderness, spasm, increase in tissue temperature, and ecchymosis in the area, like any other contusions that we see across the body. For treatment, we want to make sure we rice along with NSAIDs to decrease that pain and inflammation. Prevention, other than wearing appropriate sports equipment, there's not much that we could do to prevent, but we know that if they do have a quadriceps contusion, we do want to put some extra padding in the area when they go back into play just to help prevent another one from occurring. Hamstring strains are very similar to our quadriceps strains. When we look at hamstring strains, they're really more common than quadriceps strains, and they can occur to the semitendinosus, semimembranosus, or the biceps femoris muscles. And they typically occur because often the muscle is concentrically or eccentrically contracted during activity, such as when an athlete pushes off the blocks in track, or they decelerate after a quick sprint. Another common mechanism is when there's a muscle imbalance between the quadriceps and hamstring groups, as well as high velocity activities such as running and jumping. Another thing that predisposes an athlete to a hamstring strain is that flexible hamstrings or a prior hamstring strain may also make them more at risk for a hamstring strain. Signs and symptoms: they may feel a snap or pop depending on the grade of the injury. You could see in that picture that this is a grade 3 type of hamstring strain where there is a bulge. We may also get a divot just like the quadriceps strain. They'll also exhibit swelling, ecchymosis, point tenderness, loss of range of motion, and strength in that area. For treatment, we want to rice, use NSAIDs and crutches again, similar to the quadriceps strain, and we may want to refer them to a physician if it is that grade 3 hamstring strain. Prevention: hamstring strength is really important to prevent hamstring strains, especially when we want to balance the musculature of the quadriceps and the hamstrings. Last but not least, we have iliotibial band syndrome. Iliotibial band syndrome is described as an overuse chronic injury to the iliotibial band. This occurs because of repetitive constant friction of the IT band over the lateral femoral condyle. It can also occur at the greater tuberosity of the femur. And this friction occurs with activities that require the athlete's knee to repetitively move from flexion to extension, such as in running. IT band inflexibility and abnormal gait also promote iliotibial band syndrome. Signs and symptoms that we see: they may complain of a popping sound or sensation that over the lateral femoral condyle or greater trochanter, along with tightness, rigidity, or very, very tight IT band, and point tenderness. For care, we want to make sure, because it is an overuse injury, we're allowed to use heat. We can heat the area to relax it, stretch prior to activity and exercise, and an ice pack after exercise. We can use other modalities as well, but that's kind of outside the scope of this class, so we're looking at immediate care. For prevention, athlete can wear properly fitted shoes and stretch the IT before activity.